Welcome to Philips Studio. I'm Craig Phillips and founder of Philips Studio back in 1995. I'm delighted and honoured to have been asked by Orbis to talk about what we do on their Unlock the Power of Simulation virtual symposium. Our aim has always been to service all aspects of simulated ophthalmic surgery by using a range of specially designed tactile materials to closely represent the feel and fidelity of the human eye. I hope you enjoy this presentation and find it useful, and I look forward to your questions later. One of the greatest assets we have at Philips Studio has always been the relationship we have with you, the doctors, the charities, the surgical industry, and our suppliers. Your critical feedback and vision is key. I will start with running through the function of the eye holders before we focus on the eyes. Currently, we have 4 different types of eye holder. The basic eye holder, which holds most of the eyes apart from strabismus. The advanced eye holder, which can also accommodate strabismus eyes. The STEMI eye holder, to accommodate the increased popularity of operating with the STEMI microscope and can also hold all PSIs. And the SRT head, short for Simulated Rotational Training Head. This is our latest design and can take all of the PSIs and can also accommodate animal tissue if needed. The head has suitable anatomy to get in the way and can be tilted or extended as required. The SRT head can easily be dismantled and stored in a robust flight case only 6 cm deep, along with a drainage tray if required. These have become a popular choice due to its versatility and compact size. This is John Ferris, operating on the PS013 GelCat eye. Showing the fidelity of the capsular axis on the pre-stained lens bag and phacoemulsification. There are several types of cataract eyes in our range, including advanced cataract, PS025, which allows you to create heart-stopping scenarios such as the lens falling into the back of the eye. Here, Will Dean is operating on the PS027 Small Incision Cataract Surgery Eye, or M6. This eye creates all the anatomical and tactile feedback required for success in this procedure. Due to the complexity of this eye, courses may start dexterity and confidence building on fruit or foam, then using the PS022 basic trabeculectomy eye, and then finishing on the small incision cataract eye. Will Dean has proven success in Africa and around the world on how simulation affects the quality of ophthalmic surgical outcome. This is the insertion eye section, including PS014 lens insertion, PS029 a phakic intraocular eye, and PS031, which Tom Oetting from Iowa is demonstrating in the next video.
Hi, this is Tom at the University of Iowa. I recently went on a trip with Orbis and met Dr. Ramos and Dr. Dela Cruz in Trujillo, and we used these Philips Studio eyes, which were fantastic for practicing the glued IOL technique. Here you can see we're able to make a scleral flap with a crescent blade, make a sclerostomy use microforceps to grab the leading haptic, and then able to place those haptics using the handshake technique. Here we're going to pull the leading haptic out. We're going to place the trailing haptic in. We're going to do the handshake technique with microforceps. In this case, these are retinal microforceps they happen to have on the plane in Orbis. We even made the little side pockets to tuck in this artificial scleral material. These Phillips eyes are spectacular for this glued eye well simulation. This is Tom of the University of Iowa. Thank you very much.
This is the PS033 Malugan and Circlage eye. The iris material used demonstrates the tactile feedback required for practice and cognitive skills development through this tricky procedure. Here again, Tom Oetting kindly demonstrates.
Hi, this is Tom Oetting, University of Iowa. I'm going to show you a great simulated case that Tony Chung did, who's one of our great chief residents here at the University of Iowa. You can see that he's using 9-0-proline on a double needle that's curved and long, and now he just coupled with a cannula to get it out through the paracentesis without catching any iris tissue. And now we're about 2/3 of the way through this cerclage suture. He's going to use inside-out coupling here with the 27-gauge cannula to get the needle through the cornea without catching any tissue. And now he disengages, and now he's just going to wrap it around his needle just like you do when you're doing this cerclage technique. It's very, very high-fidelity simulation using both hands. It's very easy to do. All you need is this artificial eye, which is the Philips Studio Malugan ring eye, PSO33. And we're going to once again couple from the outside in with a 27-gauge cannula so we can get this needle out without catching any iris tissue. And now we've got a beautiful cerclage which really, really looks like the real thing and feels like the real thing. We're going to do the modified knot that Dr. Ahmed has taught us, and that is you first tie the knot on the outside, and then you grab very close to the knot and just push in, and you can bring that knot down, set the tension fairly well, and can't make it too small because it's only so elastic here. But we're gonna just really have a nice simulation here. We're gonna lock it with this second pass, and you can see what a great simulation this is for the cerclage suture of the iris, which is a pretty tricky thing to learn and to practice. Well, this is Tom of the University of Iowa. Thank you very much.
Welcome to the corneal section featuring PS016 basic suture and PS028 DMEC eye. This video demonstrates corneal lacerations for assessment and repair. You can also add foreign bodies. In this case, an old PS012 basic phaco eye is being used, helping to extend the value and use of the eyes. This video, also courtesy of Simulated Ocular Surgery, shows the DMEC procedure incorporating two eyes, the PS028 DMEC eye and the PS022 basic trabeculectomy eye. It demonstrates endothelial stripping, scleral tunnel, introducing the graft and positioning of the graft. Again, once these eyes are used, they can be incorporated into other skills training such as incision making and suturing. Welcome to the strabismus section, featuring PS017B basic squint, incorporating 4 rectus muscles, and PS017A advanced squint eye, incorporating 4 rectors and either a superior or lateral rectus depending on your choice. They also have conjunctiva and tenons. Here, John Ferris is demonstrating on the basic strabismus eye, rectus resections. There are many more great videos on the Simulated Ocular Surgery website where you can see the advanced strabismus eyes being used. In this glaucoma section, we have PS023 Advanced Trabeculectomy Eye, which has conjunctiva, 2 trabecular meshwork sites, and an iris. PS022 Basic Trabeculectomy with trabecular sites. Both of these eyes can be rotated and taped down as you would on a patient. PS017A TB Tube Eye contains an anterior chamber, conjunctiva, tenons, trabecular meshwork, and 4 rectus muscles. This is good for such procedures as Beerveld. The PS026 is for the MIGS procedure. Our vitreoretinal section shows PS010A Advanced VR with anatomy and membrane at the back of the eye. PS010 Basic VR has a lightly coloured membrane at the back of the eye to practice manipulation. PS017A BK Advanced Buckling and PS017B BK is our basic buckling training eye. Here is a clip introducing the instruments on Advanced VR Eye. As we haven't got enough time to go into detail on all our eyes and services, I'd like to finish on some of our specialist eyes, such as the enucleation eye, which was the first eye developed for Bristol University UK transplant services back in 1994. This paved the way for Philips Studio's approach to ophthalmic simulation. While we have presented several scenarios, all of our eyes can be customised and adapted for your specific application or training needs. It seems fitting to finish this presentation with a video on the PS034 Ocular Trauma Eye, presented and operated on by Richard Haynes. Besides displaying the dexterity and skill of an experienced surgeon, this eye summarises many of the features mentioned in our models and what can be achieved with Philips Studio eyes. You can see the tactile behaviour of the cornea, the conjunctiva, tenons, down to the muscles and the scleral repair, and finishing on a reattached iris. Richard also achieved a Hoffman's pocket on this eye, but it was unfortunately edited. All these skills are achievable through organised, simulated ophthalmic practice. I hope you enjoyed this presentation and hopefully got something out of it. I would like to thank Orbis again for hosting this event and to everyone who helped and assisted in this presentation. I look forward to your questions.